Good evening, everybody. Welcome back to our really 2-day spectacular. Spectacle. We knew this is live when you screw it up, right? So 2-day spectacular event here. We're working on talking about our open house for our East Side Clinic. We are opening. We were hoping to open next week, but all of our equipment is stuck in Houston, Texas, and you know what Texas is like right now. And if you watched our video this morning with Nick, you saw that it was really a problem in Texas. So we're going to have to probably push off our opening to our East Side Clinic for at least 1 week. But tonight I have a very special guest who jumped in really at the last moment, so I'm very thankful for her. I have Dr. Julie Lee with us. She is a physical therapist, and we're going to talk to her in just a second. But remember, if you want to get in on our prizes that are going to be given out tomorrow, you need to sign up. And we put that in one of our posts, the sign up link for all of our prizes. You need to sign up for that. Or you can comment, share, and like any of the videos that you're seeing, and that will put you in the contest as well. So I'm going to say spectacle. That's the word I'm looking for. Hi, Stacy. Thanks for joining us. I'm glad you're here. So I'm going to bring on Julie here, and if you have any comments or questions for her, please fill those out down in the comments on this side of the screen, and we would be happy to ask any of the questions that people have. So let me bring in Julie here. There she is. How are you doing, Julie?
I'm good. How are you, Jason?
I'm doing great. Thank you so much for joining us. I know you did this on kind of a whim, and we're fitting it in between work and children and bath time, and I just appreciate your time.
Absolutely. Thanks for having me.
You're welcome. So we just met really this week, like 2 days ago, and I'm very thankful for that, through a common friend who knew you. And ironically, she actually used to babysit for you. That's how we know. And, I'm not going to ask your age, but I know hers. And I know this was a long time ago, wasn't it?
It was a long time ago, early 90s.
And you come from a very large family, do you not?
I do, yes.
Yeah, I heard that today as well.
Yes.
You're one of 6 or 5 or 6 or something like that?
So I have 2 brothers, but my mom is one of 8. And
okay, that's the big
most of them live pretty local still. So if you know one of us, you know us all.
Okay. Well, why don't you tell our audience just a little bit about yourself tonight, just so they have an introduction of who you are, and then we'll get into why we're talking with you.
Okay. So I was born and raised on the west side of Plainfield, Indiana. I got my undergrad degree from Franklin College in secondary education, and I was a high school teacher for 4 years. That was 2007 that I graduated, so right smack in the middle of the recession. And fortunately for me, I was able to keep my teaching job, but there was a lot of talk about laying off teachers, and I started looking up a backup plan in case that would happen to me, and got into PT school and decided to run with it. So I've been a physical therapist since 2014, and I've worked in outpatient orthopedics for the past 7 years. During that time, I got married, and my husband and I are raising 2 little kiddos right now. They're ages 3 and 5. And so it was in the middle of having my 2 kids that I started to go into my specialty area of pelvic floor therapy. So I've been doing that for about 4 years now, and have just run with it. And it is my passion, and I love it. And I love helping men and women every day. So awesome.
So you own a private practice now, is that correct?
I do, yes.
And is that in Plainfield as well?
Yes, it is. Yep. Okay. It is right on US 40 and Main Street in Plainfield. So open for about 4 months.
And this is a cash-based practice, is it not?
It is, yeah. So I'm out of network with all insurance providers.
Okay. All right. So people need to know that. That's good. So, okay. So you told us a little bit about what you did, some outpatient orthopedics, which is basically what I do now. So that's our practice. But tell us, what is women's health? What does that mean I know what that means in the physical therapy world, but I'm not sure anybody knows what that means outside of our offices.
Sure. So I work on I use a lot of my orthopedic skills, and I look at hips and abdominal strength and back pain and things like that. But I take a little different approach. And I'm also looking at your pelvic floor muscles, which are the muscles that help with urination, with bowel movements, with intercourse, with birthing babies. And so I take a much, much deeper look. When we think of the core in an outpatient orthopedic clinic, we think of the abdominals, the back, the hips. I take that even a little bit deeper, and I really take a look at the pelvic floor and talk about some pretty uncomfortable things. But I work with many times it's women after they've had a baby, or even during their pregnancy, or women that have had pain, chronic pelvic pain for years and years and years, and just have not gotten all of the relief that they could potentially get.
Sure. So if someone comes in, what are some of the typical complaints that you would have that leads you to believe that this is really a women's health related issue versus, oh, this is just back pain or something like that? How do you determine that?
So a lot of times they're having very specific problems that they're uncomfortable talking about in a wide open orthopedic clinic. So maybe they're urinating when they're exercising, or maybe they're, during like intimate activities with their spouse, they're having pain, or they're having constipation, or low abdominal pain that feels like menstrual cramps almost. It does not have a necessarily like muscular component to it, but it's like low abdominal pain, and just pain with like ADLs, basically pain with bowel movements, pain with urinating, frequent urinating, urgency, like I have to go immediately upon the urge to urinate, things like that.
Okay. So out of all women, what kind of percentages are dealing with some of these very specific problems that you've described?
Ooh, that's a good question. And I don't have an answer for that right now.
Okay. Let's change it into an outpatient question.
Yeah.
When you're interviewing over your 7 years that you've been practicing, how often when you're in your history or physical with a patient that they go, you won't believe what else I have, or do you go ahead and expand on that?
So I, at my heart, I still consider myself an orthopedic therapist. I definitely look to the pelvic floor now, and every single orthopedic patient that I come across, I now think a little bit outside of the box now, and I look at them and I ask different questions. So they have, acute low back pain. Now I'm asking about when they had babies and how long has this been going on, and what do their are they constipated? Are they having pelvic pain, low abdominal pain? And I find that many, 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 many of them have other symptoms that they aren't bringing to the table right away. So
I think that happens a lot. We see that a lot in our orthopedic clinic too. And obviously I'm not an expert in this field, but just know enough to ask maybe the right questions.
Yeah.
And I think one of the educational pieces about what you do, and probably what I do, is, hey, it's okay to talk to us about those things, because there's nobody out there helping people, is there?
There really isn't. There really isn't. And I work with a lot of women that have kind of exhausted all of their options. They've done the medication, they've done surgeries, they've done holistic care, even acupuncture, chiros, and they've done physical therapy, like outpatient. And then they're sent to me, and I ask some pretty poignant questions that are different than what anyone else has ever asked them before. And they're like, I don't know why I wasn't sent to you first. I hear that every day. Or how did I not know that this was even a thing until now? So.
Okay. Is there areas, is there something where you send people to from a website perspective that might give people information that they can at least say, oh man, I have those symptoms, I need to seek out a physical therapist with specialized training?
Yeah, there's a couple. There's a gal, she's from Louisiana, and she has a website that she's actually called the Vagina Whisperer. And I know.
I never expected that to be on this show right now. You know,
I hope it's okay that I say that word.
absolutely. It's okay. Yeah. We're all adults, right?
Absolutely. And her website is fantastic. She's got some really good articles on there. She's got a great blog, and the information, the content that she, just like anywhere else, you're going to find really good content and really crummy content. And what she has on her website is fantastic. So I send patients to her all the time.
That's great. You know, obviously, this could be somewhat of an embarrassing subject to talk about for a lot of women, especially. But there's also a population of men that could benefit from some of the things that you're doing. Is that true?
Yeah, absolutely. And you know, what I've found is that men have a harder time finding care. There's a lot of pelvic floor therapists that don't treat men necessarily, or don't feel really comfortable treating men. Most of us stereotypically are females that are pelvic floor therapists, but men have pelvic floors as well. They have pelvic pain. They have pelvic related surgeries, and they have to recover from that. Men urinate, men have bowel movements just like women. So absolutely, yes.
So take me back a little bit, because I wonder why we just got like 3 smiley faces, laughing faces for that. So I just want to let you know that's great. But let's go back. I mean, when you're in outpatient orthopedics in 2014, you know, how did you say, I want this to be part of my practice? Like, how'd you transition into that?
No, there was no way. You know, I always kind of had in my head maybe I had treated a few women that were pregnant, and they're fun. Pregnant women are fun to work with. And then I had my own kiddos, and I'm a runner, and I went looking for, you know, how to get back to running and how to just feel like a mom and a PT again and feel normal. And mostly after my second pregnancy, and just had a really hard time finding good information and figuring out, like, with all of the knowledge that I had as an outpatient therapist, I still had a hard time recovering from those pregnancies. And I thought, my gosh, I think it would be so rewarding to help other women get through that point and feel like themselves again.
So, I mean, this may be a little too personal, but I mean, like, what, in order, you know, some women fly through pregnancy, have no trouble, have no issues at all. But like, what were some of your things you say, I just didn't feel normal? How did you get that?
I felt weak. I felt like my hips and my abdominal muscles were weak. And no matter how many abdominal exercises or Pilates type exercises, and I tried them all. I tried your TA
And you do Pilates as well, and yoga.
I do, yes. And it was like there was something still missing, and there was another element to it that I needed. And for me, it was, I needed to relax some muscles in order to turn them. I needed to learn how to turn muscles off in order to turn them on. I was overworking my abdominal muscles. And so for me, it was just a whole lot of education and body awareness. And honestly, that's what I do every day with women, is just teach them different ways of, often they're doing many of the right things. I just need to restructure what they're doing a little bit and tweak a few of the things that they're already doing. So
Gotcha. So we just got a comment in that said she is awesome. Yes, she is awesome. But remember, hey, if any of you are watching and you actually have a question, I will we'll pull it up. If you can say, hey, I'm asking for a friend. That's okay. You're asking for a friend. That's cool. But I mean, this is your opportunity. You know, obviously Julie doesn't practice in our area, but she's here as a resource. And you know, hey, I'm all, if I have patients, I'll send them over to Julie. I mean, this is the kind of relationship that we need as PTs, because I'm not an expert in everything, and there are things out there that I'm not going to treat. So let's go. So if you have a comment and you have a question, please put it in the flow here, so I can touch base with Julie with it. But let's go back for a second. You said you need to relax some muscles.
mm-hmm.
That doesn't make any sense to me at all, because most of the time we talk about, wow, we need this to work harder, be more, contract a little bit better. Does that make sense?
Yeah. So think of a muscle in its shortened position all of the time. Think about your stereotypical pregnant woman, that she's got her belly and she's got a great big lumbar lordosis. She's got a great big arch
nobody knows
in her
what that
lower
means.
back. Yeah. So she's got a great big arch in her lower back.
Gotcha.
So her abdominal muscles are all stretched out. So what is supporting her right there? Is it her abdominal muscles? No, probably not. Is it her glutes that are clenching to hold on for dear life to support the baby that she's carrying and all the extra weight and all the things she has to do carrying her toddler on her hip? And so it's, do you, now that you've gotten rid of the baby in your belly, your posture has returned back to normal, can you go back to a posture where you're not gripping your glute muscles or your buttock muscles so much? Can you let go of them? Can you release them? And then can you strengthen them? So
Gotcha. So that makes a lot of sense. So when women, tell me a little bit, everybody says, after you have a baby, especially, they say, oh, just wait, your body will go back to normal. And at the 6-week mark, everything's fine. That's baloney, right?
yeah, I feel very passionate about the bounce back mentality, and that wording is just it's like poison to my ears. I hate hearing that, bounce back after baby, or at 6 weeks you're cleared to. I was cleared to run at 6 weeks, and boy, I had no business running at all. And many women don't. Some women do, and that is wonderful. But I would challenge them that maybe they can run, but should they be? Should they be doing that? Just like powerlifting during pregnancy. Definitely. It is not harmful to the baby. It's not harmful to you necessarily, but is it the most appropriate thing for you at that time? Maybe, maybe not. Maybe we need to get our ducks in the line first before, and make sure you can do certain tasks ahead of time before you go back to something like running or CrossFit or things like that. So I don't believe in the bounce back at 6 weeks. In fact, I feel really strongly that at the 6-week mark or the 8-week mark for like cesareans, I think standard of care should be seeing a pelvic floor therapist just prophylactically, honestly. So at 6 weeks, you see your OB, you are cleared on her end, and you automatically have an appointment with a pelvic floor therapist just to kind of screen what are there any issues going on. And maybe you only need 1 or 2 visits to, make sure you're doing the right exercises to return to real life. And maybe you need 6 to 8 visits. I don't know. So
what, and I assume that if you have another baby or have another baby or have another baby, the likelihood that you should be screened goes exponentially higher, right?
Yeah. From what I see is that your first baby, the bounce back does happen a little bit more quickly. Then the second time around, from my own personal experience, it is a much harder process. And the third baby, fourth baby patients that I see, it gets exponentially harder each time. So, but incredibly doable also.
Is there, are there some red flags, when at the 6, 8, 10, 12-week mark that say, I need to come see you? I wasn't referred by my OB, but something's not right. What are the kind of things that just they should know right away?
I would say definitely leaking urine during any activity, coughing, laughing, sneezing, exercise, lifting, things like that. A sensation of like at low abdominal or internal pressure would be one. And then pain that is not explained easily by a hard workout or something, like it wasn't a reflection of the work that you did. So that could be pain with exercising. That could be pain with intercourse, things like that. Pain as you start your menstrual cycle again. Those would be some of the big things.
So, okay, we got some questions here, which is awesome. Lisa asks, does this work for menopausal women? And how does menopause fit into all of this?
So there's a lot of research in this right now, in particular, how hormones are affecting our tissues during the menopausal years. So absolutely, things don't naturally get stronger as we age across the board. Like that's just how it is. And so those hormonal changes, in addition to changes in our muscle tone as we age, can have a big impact on the support of our bladder or the support of our rectum, or so there we're talking prolapse symptoms and things like that. Pain is really big with the perimenopausal and the postmenopausal population as well. And so absolutely, there is a big boom in that right now, that is exciting. So.
Sure. Yeah, I think I hear a lot all the time as clients come in and patients come in all the time that say, well, what happened last year, and they're like, my body fell apart, everything changed. And so this is extraordinarily common, and people need to seek the help, right? It's okay.
Yeah, absolutely. Yeah. And I think that's a big thing, is the stigma that you're having those symptoms. So are so many other women that aren't necessarily talking about it. So just talking about it more makes it, kind of destigmatizes it, and makes it more of a normal thing, because pelvic pain is very, very, very common. So,
and let's see, I have another that says, Kim says, so many women think that so many women think I've had 3 kids. Oh, because you had 3 kids, leaking urine is normal.
Oh, nope.
That's not
Leaking
normal.
urine, no, that tells you that there's something dysfunctional about your pelvic floor. So definitely something that should be addressed. And, so we have direct access in Indiana. So going to see a pelvic floor therapist directly, you can see them for 6 weeks, going the route of talking to your OBGYN or a urogynecologist are two ways to kind of get into therapy other than direct access.
So that brings up my next point. So if someone wanted to contact you, what's the best way to touch base with you?
Yeah, so you can visit my website, www.julieleept.com. And you can send me messages directly from my website. You can schedule an appointment right there. You can find out a little bit more about me right from my website as well.
Okay, great. There was another question here is, so are there anything exercise-wise that I can do at home that strengthens the pelvic floor? So, that we ask that all the time. People ask that all the time.
Yeah.
Is there I personally, just so you know, don't like, these are the 3 best exercises for back pain. I did a video earlier this year about that specifically, because I don't like that at all. But is there some tips that you might be able to leave the audience with that will be helpful?
Yeah. So the big thing to kind of talk about that is, it's not always, if you're leaking urine, if you feel like you're weak, it is not always just do your Kegels and to strengthen. So for example, I had just had a baby. My issue, it was ultimately I needed to get stronger, but before I could do that, it would have been like doing bicep curls with a really, really tight muscle and trying to do more and more weight on a really tight bicep and never being able to fully relax. Can't see my arm from here, but fully relax that muscle. So one of the biggest things that I hear from OBGYNs is, I gave the patient Kegels to do because they were leaking urine. Well, that may not address their problem. So getting an assessment by somebody who's trained in what to look for is the biggest thing, to be honest with you.
So Stacy from Texas says, where were you, Julie, 28 years ago?
Oh, you know what? It's never too late though, Stacy. Honestly, there are so many women that I see now at, and I ask them about their hip pain, and they say, you know what? My daughter is 32 years old. So this hip has been bothering me for 32 years. And we dive in a little bit deeper, and boy, sometimes we can make huge changes in their quality of life that they've lived with for 32 years. So I would encourage you to go find a pelvic floor therapist and see what you could find, see if you could get relief.
Outside of what we talked about, meaning like leakage and constipation and pelvic pain, are there other symptoms that you see in patients where you say, aha,
yeah,
I know that's the pelvic floor? What did they, because it might be back pain, it could be glute pain or hip pain or groin pain. So why don't you touch on that?
Your SI joint patients that come in and they have pain at their sacroiliac joint, but it's not textbook sacroiliac joint, their SI joint tests, which is a physical therapy, kind of an orthopedic screening tool that we use. Their tests are not positive. They haven't responded well to stability type exercises. Something else is going on there for sure. Low back pain, mid back pain as well. Your lower thoracic spine and your upper lumbar spine, your thoracolumbar junction, that's where all of the nerves that go to the pelvic floor originate. So pain in their mid back, or somebody who hinges a whole lot, their posture hinges on their mid back. That's another place that we're going to look. Constipation is a big one, honestly, that they're having low back pain and then they have constipation. That to me is a trigger that there might be something else going on there.
Interesting. So going back to the mid back region, what about those women have those postural changes? I mean, is that something that you would address in a clinic setting then?
Yeah, absolutely. So as far as what I work on, like body region, I honestly work on feet sometimes. I work on like necks and suboccipitals and kind of everything in between in the clinic. Because I find that a lot of times it's not just the pelvic floor. There might be a little bit of motor control work that needs to be done at the pelvic floor, but their abdominal muscles are also, or their obliques are not like participating as a part of the team, or their thoracic rotation is not very good. That's honestly a big one with runners. So
awesome. So we're running short on time, but what I want to, what should someone expect when they come and see you for the first time? Because if I was coming to see you for some of that, I might be a little nervous. I'm not sure what you're going to do. So can you just maybe guide us what would happen in an initial exam?
Yeah. So first and foremost, don't ever be afraid. Most therapists are very willing to take a phone call and walk you through any concerns or questions that you might have, myself included. So first day, typically I have the patient come in and we're sitting having a pretty long conversation about what are your symptoms like? Where did this originate? What are all of the things that led up to where you are right now? Then I'm going to ask some pretty specific questions about your urinary system, about your bowel health, about your pelvic floor, and about your history that you've had. And then I'm going to do an orthopedic assessment. I'm going to look at how your lower back looks. I'm going to look at what your hips look like. I'm going to look at your abdominal strength, your hip strength, what your thoracic spine looks like, what the tissues in the abdominals and the glutes. So much like what I would do in a busy outpatient orthopedic clinic. Sometimes we do an internal pelvic floor assessment, meaning we do a vaginal assessment. In some instances, there is a rectal assessment. Now, both of those would be completely up to the patient's comfort level. And it's always, if you're not comfortable with it, we just bypass that and go a different direction until you are comfortable with it. Or maybe you aren't always, you are always in control on what we do. And then I typically give a handful of exercises for you to work on at home. And that's usually your first day. So,
okay. So that'll put a lot of people, I think, at ease going in. The question from Cindy, is it normal to have constipation after hysterectomy? She's asking for a friend.
I would say constipation is never a normal thing. So no, it sounds like.
Start by talking to your family doctor, right?
Yes, absolutely. Yep. Or following up with your OBGYN, whoever did the surgery.
Gotcha. And so if people have viewed this video and they're out of town, they're not local to you, they're not local to Indianapolis or myself in Richmond, if they needed to find a pelvic floor therapist in, say, Columbus, Ohio, how do they do that?
So two options that I give to people. So the continuing education entity that I've taken a lot of classes with is called Herman and Wallace, and they have a find a therapist option on there. Another one is a website called Pelvic Guru, and it's a physical therapist that has created kind of her version. She's got continuing ed classes, and she has a find a pelvic floor therapist on her website as well. And I believe both of those are worldwide. So if you're outside of the country,
you should be able to find it. So,
yes.
All right. Hey, we've gone almost 30 minutes, which I can't believe. It's been fantastic. I don't have any more questions from our group. I'm done with my questions. Is there anything that you'd like to leave us with as your sign off 30 seconds here?
Yeah. So the biggest thing is if you're having pelvic floor therapy, or sorry, if you're having pelvic floor issues of any kind, you're leaking urine, having pain, prolapse symptoms, endometriosis, interstitial cystitis, any of those, don't be afraid to reach out to a therapist, because most pelvic floor therapists are very passionate. Otherwise, we wouldn't be doing the job that we do. And so reach out. You may just be asking questions, but don't be afraid and don't be intimidated that it's scary, because it's not. We're going to make you feel as comfortable as we can. So.
Awesome. Well, lots of really awesome comments that you'll probably be able to read afterwards. So Dr. Julie Lee, it's been fantastic to have you on tonight. I hope we can stay in touch, and maybe if we do some updates 4 to 6 months from now, we can chit chat again and just see how things are going. And if you want to get in contact with Julie, julieleept.com. And she, I'm sure, would be glad to answer any questions that you might have tonight. So it has been awesome to have you. So thank you so much for stepping in. You've been great. And hopefully we can do this again sometime, okay?
All right. Sounds good. Thanks, Jason.
Great. Thanks, Julie.
Uh-huh.
So just remember, everybody, if you're joining us, if you're going to join in on our prizes for tomorrow, you need to like, share, comment on this video. That'll put you in, but also you need, or you can go to the landing page, which is at the Cutting Edge on our post. So go back in our little bit of our history, which is probably 2 days ago or yesterday of our post. It gives you the link to join for our contest tomorrow. And I got some more prizes, including some headphones today. I also got some auto change, oil change type kit things today. So just more prizes came in today. So super glad to have all you here tonight. I hope you guys have a great night, and we'll see you tomorrow starting at 8 a.m. And we have a bunch of great interviews. So have a great night.